patients. Right now, her goal is to improve the health of more people by working to heal the climate. She's been involved in climate issues since early in the 2000s, in 2005, and now is very much focused on educating people, health practitioners, policymakers, about the connection between health and climate change. Dr. Mahoney serves as an advocate for the Medical Society's Consortium on Climate and Health, as well as a member of Climate and Health team of Citizens Climate Lobby. She lives in Danville, California with her family and loves to explore the wonders of science and humanity. And we are truly very honored. Dr. Mahoney is very involved with Citizens Climate Lobby, which, as you all know, is one of our partners. And I'm going to turn the presentation over to her and sit back and enjoy.
All right. Well, thank you very much. I want to thank Jerry Friedman for organizing this, and Elders of Climate Action for giving me the opportunity to speak about something that's very near to my heart, critical for me as a physician and a mother, not yet a grandmother, but hopefully someday. And this is a very timely talk because, let me see if I can move. Because the American Public Health Association called 2017 the Year of Climate and Health. And we are certainly seeing the climate changes, the warming and wildfires, the melting of the poles and glaciers, the sea level rise that Jerry was just talking about, extreme weather. And all of this climate disruption affects human health. And my goal today is to show you how climate change is impacting our health here and now. Also, the effects of fossil fuels, not just to cause climate change, but also how they impact our health right now. And then to look at solutions and ways that we can use this health issue to connect with other people. So the folks from George Mason University who work on climate communications have suggested that the best way to communicate is to use this kind of a format where we talk about the issue, which is that climate change is bad for our health, the problem, why we should care, what the benefits are, and what the solutions are. So the problem is that climate is harming our health now. We're seeing this in all sorts of illnesses, which I'll go over in more detail. Why should we care? Because any American can be harmed by climate change, but some are more vulnerable. I'll go into that later. The benefits, well, that if we don't take action, things are going to get much worse. And the good news is that if we take action now, there are benefits from decreasing fossil fuels that will protect our health now. And a good way to think about it is that what's good for our climate is good for our health, and what's good for our health is good for our climate. And then solutions. We do have good solutions. We need to decrease heat trapping pollution by reducing fossil fuel energy use. And we can do this. And to accelerate that transition, that will result in cleaning up our air now with immediate health benefits. So every time I see this slide, my heart just goes out because it just shows the issues we have, that climate change isn't about temperature, it's about people, and that Americans have been dragging their feet towards this crisis. The one that this particular author is talking about is the crisis of slavery, that the same kinds of arguments and methods were used, that, well, our society can't afford it, we can't change, there's nothing we can do. And I used to start all my talks with this slide, and then I realized I can't do that when I'm talking to Americans. We have to talk to people about what's here, what's now, what's affecting them. And unfortunately, all too many people would just let this slide by. So for that reason, most of what I'm going to talk about today is about what's happening in the US rather than globally. We know that climate change is the biggest global health threat of the 21st century. Impacts will be felt all around the world, not just in some distant future, but in our lifetime and those of our children. That's a statement from The Lancet. I'm sorry to say this statement is 10 years old, but it's coming true even more seriously than we anticipated. One little bit of good news is that physicians in the US are starting to recognize this. I mentioned that the American Public Health Association called it the Year of Climate and Health. The New England Journal of Medicine put out an editorial saying that taking care of the climate is preventive medicine for the planet and its people. I think I kind of skipped over that. Let me just go back one moment. There it is. Yeah, the New England Journal of Medicine. And the Medical Society Consortium issued this medical alert. The Medical Society Consortium is a gathering of the major medical societies in the country. So it includes all the internists, the American Academy of Pediatrics, the Obstetric and Gynecology, the American Medical Association. So these associations representing over half the doctors in the US are now saying, hey, there's a problem here and we need to do something about it. And so what are doctors saying? Well, physicians are urging action. They've rung the alarm saying that climate change is harming the health of Americans. This isn't just some global problem somewhere off in Africa. This is us, and the consequences could be catastrophic. Fossil fuels drive climate change by releasing greenhouse gases with these impacts that are shown here, and I'll go over these in more detail. And importantly, the sooner we take action, the more harm we can prevent. Before I leave you too depressed, the Lancet Commission also said, and this is very important, that tackling climate change could be the greatest global health opportunity of the 21st century. So if we do this, it's not going to take us back to the Stone Age, it's going to take us forward to a healthier human race. And I'll show you why that is. So we know that increasing CO2 levels cause rising temperatures. That trapped heat energy, which is like 400,000 Hiroshima bombs every day, energizes the whole climate system. So we have more extremes, both more extreme droughts and more extreme rainfall. And that the sea level is rising both because of expansion and the melting of glaciers. And these all lead to climate disruptions that then impact our health. So if you look at I don't have a pointer here, at the upper left at 10 o'clock, we see extreme heat, which causes heat-related illnesses, severe weather with injuries and fatalities, worsening air pollution, exacerbating asthma, changes in vectors, which means like mosquitoes and ticks, causing all sorts of nasty infections to be spreading, increased pollen growth, which is worsening asthma, water quality is degraded, for a variety of reasons. We're seeing problems with water and food supply leading to malnutrition. And most concerning is that the impact of these things is going to cause forced migration, civil conflict, and mental health impacts, which we're starting to see already. So I'm going to go through a few of these in more detail. Let's start with heat. We know that 2015 and 2016 were the two hottest years ever recorded. And here in California, it was so hot, it topped 120 degrees, and 5 counties had to open cooling centers because of the public health risk. And this year, it was so hot that we had 4,000 cattle die in the Central Valley. So this is a real problem. We know that summer temperatures have shifted. It used to be that nice green line, a bell curve, where a third of the temperatures were below normal, a third were normal, and a third were above normal. Now they've shifted so that you see in the orange, we have many more hot days, but we have what's worrying, many more extremely hot days that really put humans at risk, and cows. How hot will it get? Well, we know that in the recent past, it was pretty rare to have areas that had very many days over 95 degrees. But if we continue business as usual, that's the lower map, the number of days over 95 degrees by the end of the century, New York City will go from 2 days up to 42 days. Dallas will go from 30 to 133. That's almost unlivable. And some people think, well, it's a nice warm day. That's cool, right? We hang out by the pool, kick back, have a margarita, go inside in air conditioning. No, heat kills people. In our 2000s, and not just in third world countries, in 2006, our California heat wave that was over 100 degrees for 2 weeks and critically doesn't cool at night. So your body has no chance to recover. The death toll here in California, not the third world, was in the hundreds, with huge demand on the medical system, ER visits, hospitalizations. And notice, people lost electricity. So much for using your air conditioning to withstand this. In 2003 heat wave in Europe, 45,000 people died. And there was a heat wave recently in Russia, I just read about a couple of years ago, and they're now saying maybe 50,000 people died in Russia. So this is serious. And by the end of the century, if you look in the section in the upper right, we're projecting hundreds of deaths in every major city in the US every year. So that's heat. Now let's turn to extreme weather events. So we know we have these hurricanes, downpours, wildfires, droughts, rising seas. And these cause the typical expected things like injuries, like degraded water, sewage overflows, but also there's a problem with infrastructure and electricity. So this is from Puerto Rico. You see these downed power lines. So people can get killed, be electrocuted. That's happened in Texas, in the water when they don't see the downed power lines. And how do you think somebody evacuates past this? How do you think emergency help gets in past this? It's really a problem. As we have flooding, our sewers aren't meant to take care of that. What do you think is in this water? I don't think we want to think too closely about it. And when you have floods in places like Houston with all the petrochemicals, nobody knows what's in that water, but they know it's not good. And there were also releases into the air of toxic chemicals because the plants were unsafe and were at risk of burning or exploding. So they just released toxins, and the regulatory system gave them a pass and said, oh, well, it's too bad, you can't really do it, so we won't even measure it, we won't even ding you for this. And all that moisture then leaves homes with terrible mold problems, which is very toxic to people. It aggravates any breathing problems. And everything that's been touched by this water, even though it dries out, is contaminated with toxins, with feces. So it's tremendously disruptive and destructive, and a huge risk to health. We know in Puerto Rico, there have been multiple deaths now from leptospirosis, which is a bacterial disease that comes from the urine of rodents, and that gets into the water. And now people wading through that water are dying from that disease. What about wildfires? Well, we're certainly having those here in California now. This is a picture actually from a year ago, but it's the same kind of thing. We had something called the Rim Fire up in the Sierras, and I happened to be there the day the fire started. I saw one plume, and over the next couple of days, the air turned like this, and I thought, what if I had asthma? What if I was in a wheelchair and couldn't just decide to drive back to the Bay Area? This is really hard for people. And the wildfires aren't just destructive in terms of the fire and the deaths from fire and the evacuations, but also the smoke. This is a satellite photo of the US. If you look over on the far left, you can just barely make out California with those red dots in the northern part. That's Northern California getting into Oregon and Washington. And then you see more red dots over in northern Idaho. But the smoke from those wildfires travels on the jet stream for thousands of miles. So it's not just the people in that town. It's all across the US that people are getting exposed to tremendous amounts of particulate pollution. I heard recently that the amount of smoke, particulate pollution from California fires this year has already exceeded the amount from all the cars in California for a year. So this is a big deal. And you'll learn more about particulate pollution as we go on and how damaging that is. So in terms of the number of events, we're seeing more and more of these. If you look along the bottom of this graph, this goes from 1980 to 2015, red shows the geophysical events like earthquakes and volcanoes. Those aren't increasing, but we see more and more billion-dollar loss events in the meteorological events, floods, extreme temperatures and droughts, and it doesn't take much imagination to see where this is going. This is a tremendous cost in infrastructure, but also in lives and health. The prediction is that heat alone will cause $500 billion worth of health loss by the end of the century. Let me see here. We mentioned water and foodborne diseases. It's been said that climate change is making the world a better place for microbes. It's more hospitable for microbes than for humans now because of the warmth, the rainfall, the flooding. And one example of this is toxic algae. The glass on the bottom left is the drinking water from Toledo, Ohio in 2014, where a toxic algae bloom made the water completely undrinkable. These toxic algae blooms you can see spread across the US in fresh water. They can actually cause pneumonia from people swimming in lakes. The breeze across the lake pulls them up into the air and you can get pneumonia. The bottom picture on the right looks pretty. They're beautiful red tide, but it's very toxic. And so you see on the upper left, it infects shellfish and makes them inedible both for humans and sea creatures, and can really deplete the sea life and fish and be a problem with nutrition or access to nutrition. This is also a problem caused by the heat directly. So 90% of the heat that's been trapped in the earth has been stored in the ocean, and that ocean warming is causing coral reefs to bleach, and they're a major source of fisheries. And also the CO2 is absorbed in the water, makes it more acidic, and it makes it hard for shellfish to form their calcium carbonate shells. So there's a problem with the plankton and tiny creatures at the base of the food chain. So predictions are that this is going to get to be a huge problem, and a third of the world's population depends on the sea for food. Droughts and water scarcity, I don't think we need to go into detail. You understand what that's all about. Malnutrition for a number of regions. This article discussed the fact that not only do we have droughts impacting this, rainfall washing out the or rotting the crops, but when there's a earlier spring, sometimes the trees or plants may flower before the bees or pollinators come out. There can be an asynchrony there that could have a major impact on crops. Also, as people think that, well, don't plants use carbon dioxide to grow? Aren't they going to be better and grow better if there's more CO2? Well, yes, some of them grow faster, but that's actually bad because they have more carbohydrate and less protein and less micronutrients. So they're actually less nutritious. That's not a problem in America, but in third world countries where there's borderline protein intake, that's going to be a big problem. Mosquitoes and ticks. So mosquitoes are spreading and they carry a lot of terrible diseases that we hadn't had to worry about for a while, like malaria and dengue fever. Also new diseases like Zika. I mean, how many of us imagined we would have to tell pregnant women, don't travel to Florida because you might get Zika. My partner actually had to cancel her vacation to Disney World last year because she was hoping to have another child and her doctor said, don't go. Ticks are also expanding. They're now up as far north as Minnesota. We have an epidemic of Lyme disease, over 300,000 cases a year. And we're discovering how serious that is. Probably 10% of people who contract Lyme disease develop chronic illness that's very debilitating with neurocognitive effects, psychological effects. So again, this is a huge potential reservoir of disease. We're just barely beginning to understand how much this can impact us. And I don't think I can overstress the impact of all of this on our mental health. Heat has direct effects on mental health, causes irritability, aggravation, violence, increases suicide, but also PTSD from stress, from leaving your home, from seeing someone die, and it decreases community cohesion, a sense of belonging. So this is a really major problem. And we've said that all humans are at risk, all Americans, but there are populations of concern. Certainly the indigenous peoples who often live close to the coasts where their sea level is rising and eroding their homes. The elderly who have maybe other medical illnesses or disabled. First responders who breathe that smoke in the wildfires, who see the stress. Outdoor workers who are suffering heat illnesses. The mentally ill who often are more susceptible to heat because they're outside, and also their medications may make it harder for them to adjust to heat. The poor who have no defenses. Pregnant women are more susceptible, and young athletes who are out playing in the heat. Older adults are also more susceptible because of chronic health conditions that may make them more sensitive to heat, like diabetes or heart disease. And older adults on limited income may not turn on their air conditioning, may not quite realize how hot it is, and yet get dehydrated or overheated. Extreme events also impact older adults more because power outages can affect electrical medical equipment or elevators, so it's harder for them to evacuate. And the Defense Department and military are very concerned about these climate change impacts, saying that they're a threat multiplier because the military often has to respond to help with natural disasters, but also the conflict and migration that will occur as a result of this. So all of these health impacts have tremendous costs in terms of suffering, human suffering in our health, but also monetary costs. So how do we get a handle on that? Well, extreme weather events, 6 events from in the decade 2000 to 2009 were studied and showed that there were thousands of deaths, hospitalizations, medical utilization, costing about $14 billion. And we know that's increasing. We've had at least a dozen billion-dollar events in 2016 alone, and I showed you that graph of where that's going. Conversely, if we keep warming below 2 degrees centigrade, the predictions are that we'll avoid thousands of deaths, millions of school and work days lost each year, and the health benefits are valued at $200 billion a year in the US alone. That's not even counting infections, mental illness, malnutrition, conflict. So when people say, can we afford to take action? I think we can say, can we afford not to take action? A new study just came out, I think yesterday or today, from the General Accounting Office, saying that the health costs from heat illness alone by the year 2100 could be $500 billion a year in healthcare. I want to turn a little bit now from the climate impacts to fossil fuels. So we know that fossil fuels, burning fossil fuels, releases greenhouse gases, carbon dioxide, and methane that cause climate change. And I've shown you how that damages our health. But also the pollution from burning fossil fuels directly damages our health here and now, irrespective of climate change. And those costs, those impacts have mostly been hidden from us. We didn't really know about them until recently. But now we know they're serious, they're widespread, they're costly, and that clean energy will improve our health and economy now. So burning fossil fuels is hazardous. It releases NOx, nitrous oxide, VOC, volatile organic compounds, SO2, sulfur dioxide. And in the air, those combine, and they combine more with more sunlight and the hotter it is. So climate change will make this worse. But even now, they form ozone, O3, and particles, particulate matter, that are very toxic to our health. And ozone is the main component of smog. It's like getting a sunburn in your lung, and that increases the incidence of asthma. We're actually in an epidemic of asthma right now. And the situation of these pollutants from fossil fuels is really analogous to secondhand smoke from cigarettes. So we know years ago, people smoked and they said, well, you can't tell me not to smoke because I'm only hurting myself. And then we discovered that no, that smoke was harming everyone around you. And we've taken action to try to limit exposure to secondhand smoke. Well, fossil fuels are like that. When someone burns fossil fuels, it affects the air all around them, and everyone who's breathing that air is affected. Also, like cigarettes, and the cigarette companies that fought this like crazy, the fossil fuel companies have fought this using the same ad agencies even. It blows my mind. There's a wonderful book called The Merchants of Doubt, which also has a movie that shows very clearly how the fossil fuel industry set out to deceive people, denial and delay, to prevent people from taking action on this. How big a problem is it? Well, the asthma, now almost 1/10 of Americans have asthma, mostly children, and it causes thousands of deaths. And although our air is much better than it was in the 1970s, thanks to the Clean Air Act, in fact, almost half of Americans live in a county where the air does not meet EPA standards. And even here in California, where we have the strictest environmental standards, we have 5 or 6 of the worst metropolitan districts in terms of air quality. So I talked a little bit about ozone, but even more important is particulate matter, which you'll often see abbreviated PM 2.5. So particles come in different sizes, but the smaller ones, 2.5 and ultrafine, are the ones that are very dangerous, because these particles are so small that when we breathe them in, they can be absorbed directly through our lungs into our bloodstream, and they go to our brains, they go to our hearts, they go to our reproductive organs, and cause tremendous damage. So I think people kind of intuitively understand that air pollution is bad for our lungs and could cause asthma or lung cancer. But all of this, the heart disease, the reproductive problems, the brain problems, has only started to be understood in the last 20 years and really more in the last 10. So even a lot of doctors don't know this. But fossil fuels now in the US cause 200,000 premature deaths every year, an additional 180,000 non-fatal heart attacks, and then tremendous healthcare utilization. More recently, we're linking this particle pollution to strokes, to fetal harms, to learning and behavior problems in children like autism and ADD, to causing diabetes and even dementia. So this study from UCLA of teachers who grew up near traffic versus ones who didn't showed that the ones who did not get exposed to traffic had arteries like the one you see on the left, where the dark red is the artery muscle and the white shows the open center of the artery. So lots of blood can get through. The picture on the right shows the artery of someone who grew up near heavy traffic, and you can see that the wall is very thickened. There's lipid plaque in there, and the area for the blood to get through is very, very small. And there's a 40% increased risk of cardiac death. These are 4 other studies: the Women's Health Study, American Cancer Study, the Harvard 6 Cities Study, showing that for the population as a whole, an increase in particle pollution causes a 20% increase in cardiac death. And for older women, a 70% increase in death. And that 10 microgram per meter squared is within the range of what you could see in heavy traffic, near a refinery, from smoke from a wildfire. So this is something that people see. This is not a big increase. And more recently, there's showing that these particle pollution is a strong determinant of dementia, like 80% higher incidence of dementia in people exposed to heavy particulate pollution. It also impacts fetal and infant health, causing premature deaths, spontaneous abortions. So this is a pro-life issue. Most of the discussion is about CO2, but it's important when you're thinking about what policies matter to realize that methane is also a significant greenhouse gas. That's the main component of natural gas, is actually methane. And methane also comes from cows. Yes, Bessie, it was you. The burps and farts of cows release a lot of methane, as does clearing forest to move it to grazing land. So it's loss of the forest sink. So altogether, growing meat for agriculture may account for up to 15 or 20% of global warming, and methane has a specific effect. Also, methane, because it's 20 to 100 times as potent as CO2, even small leaks of methane can contribute to global warming. So methane can leak from anywhere from the fracking site to the pipelines to the urban pipes. This is a picture of Boston and all of the methane leaks that they saw from the pipes. And fracking itself has health hazards because they use hundreds of chemicals that they won't tell people about because they're proprietary. But these are often very toxic chemicals that are associated with heart disease and cancer and stillbirths, and a lot of symptoms that can be both from the methane and from some of these toxic chemicals. So I've shown that fossil fuels have hidden health costs, both in terms of the health impacts, and these occur both because it causes climate change, the air pollution, and water pollution from fracking. So now stop and think for a moment. Imagine a healthy world powered by clean energy. Would that help our health? And what is it worth? Well, I loved this study. I don't know how many of you have heard of Carmageddon. This was in Los Angeles about 10 years ago. They were going to have to close down the major freeway, the I-405, for repairs one day. And everyone was panicking about how bad the traffic would be. So everybody just stopped driving that day. And you see the picture of the freeway, there's no one there. The particulate pollution dropped dramatically from just one day of no traffic. And amazingly, emergency room visits to the hospital next door, to UCLA, decreased 23%. And these weren't just for asthma or lung disease. All-cause emergency room visits just dropped. So this is amazing. So getting rid of particle pollution immediately improves our health. And we know that if we went completely to a clean energy economy, we would prevent all of these heart attacks and deaths, valued at over $500 billion per year. This study from MIT showed that cutting fossil fuel emissions would pay for itself if we do it by pricing carbon, because the regulations are much more expensive, and like fossil fuel standards, they're good, but they're expensive to implement. Whereas if we put in carbon pricing, then the benefits are tenfold what we get for the cost. And if we translate that into a price on carbon, we could say that the health care benefits are worth $200 per ton of CO2. So it's analogous to the social cost of carbon that people have said is about $40 a ton. The healthcare benefit costs are an additional $200 a ton in the US. In Asia, where they have so much more air pollution, they're even higher. Now, I said earlier that tackling climate change could be the biggest healthcare opportunity. And that has to do both with decreasing fossil fuel pollution, but also other changes that we might make, like changing our food systems away from a heavy beef and meat-based diet to more plant-based foods would improve our health. And as we decrease our reliance on fossil fuel powered transportation and have more what they call active transportation, meaning walking to the bus, that will have major improvements in our health. In fact, Jonathan Patz from the University of Wisconsin has said we could prevent all of these heart attacks and strokes, new cases of diabetes, cardiovascular death, cancer death, as little as 10 more minutes of walking 5 days a week can have these huge health improvements. So Lady Liberty, you got to change your tune, and it would have tremendous, tremendous health benefits. And if you think about it, 3/4 of our healthcare dollars go to these preventable diseases, diabetes, heart disease, strokes, that really have a lot, and cancer, that have a lot to do with our lifestyle and our fossil fuel pollution. So this could save a tremendous amount to our healthcare system. So I've talked about how fossil fuels impact climate change, how that impacts our health, how fossil fuels directly impact our health through particulate matter and ozone. And the Medical Society Consortium came out with this summary statement that a medical alert that climate change is harming our health. It's harming Americans now, and these harms will increase unless we act, that we need to decrease the use of fossil fuels, and that will have immediate health benefits. The sooner we take action, the more harm we can prevent. And this world that we might move into doesn't have to be moving into a cave. I loved the way, I think Paul Hawkins said this. Just one moment. Right, this is not a path to retrogression or a future that we won't like. It's actually to a much better future, cleaner, healthier, with more jobs, more security, and more life on the planet. The one thing I'm sad to say, I think this is a beautiful picture, but it's from China. So they're ahead of us. So we know we need to transition as quickly as possible to clean, healthy forms of energy. What do doctors say about this? Well, the Lancet Commission has weighed in on this as well, saying the most powerful strategic instrument to inoculate human health against the risk of climate change would be for governments to introduce strong and sustained carbon pricing. And that's why I'm just so happy to be allied with Elders Climate Action. I'm heartened by your wisdom and your commitment to action. I hope this talk has given you some ways to connect with people about the health impacts, how that's a shared value, and that it will be a benefit, that taking action, getting rid of fossil fuels, will be a benefit to our health immediately and in the future by decreasing climate change, and that will have benefits for our economy and healthcare dollars as well. I hope that you'll share this message with your friends and your family. Ask them to call their legislators and ask, what are you doing to protect me and my family and my grandchildren from the health harms of fossil fuel pollution and climate change? Put a price on carbon. Thank you very much.
Thank you so much, Dr. Mahoney. I'd like to, as soon as you unshare your screen, we'll open it up for some questions.
Sure.
That way everybody will have an opportunity. If you raise your hand if you have a question, and Jen will unmute you, and Dr. Mahoney will be able to engage in a conversation.
Hazel. Yes, I love your presentation. It's great. I've seen the number on this, and it's one of the best. Thank you very much. I just wondered, is there a way that your presentation, your slides, could be made available to us? Because I think one of the things that's really important for us as we move out into the communities is to talk about this, because it's a common it's a way we can speak to people across all political alignments, and it's a way we can help people understand why they should care.
Thank you very much. That's exactly the message I was trying to get across. And I think it's really wonderful to say, imagine yourself, or to start by asking, well, you know, does anybody in your family have diabetes or high blood pressure or heart disease, or, oh, your grandmother is getting dementia. Did you hear that that could be related? Or what do you think might be causing that? Or did she ever live near heavy traffic? Or, you know, there are a lot of ways to get into the conversation in a very gentle way, and then gradually steer it towards this idea that, yeah, you know, we're learning more and more that there's a problem, and what do you think about that? And exactly those shared values. And then, you know, if we clean this up, imagine your daughter without asthma, your husband without a heart attack, your mother without dementia. Those are very powerful things. And so yes, I'd be delighted to share my slides. In fact, I sent them all to Jen Chandler so she can make them available. And feel free, the more we can get the message out, the better. 10 years from now, I might want a royalty, but for now they're good. And I also have a 2-page handout that I also provided to Jen that has just the synopsis of what doctors say, what the climate impacts are, what the fossil fuel impacts are, and how much the value of these health impacts is. That's good for giving to your legislator or other people to explain this.
And I'll be sending out an email tomorrow with the call recording and all of those links. So just expect that in your inbox sometime tomorrow.
Thank you. Any other questions or comments anybody would like to make? David?
Just a comment. I think if I'm not, if I'm correct, that surveys would show that healthcare providers are among the more trusted people in American society.
Mm-hmm.
And given that, it excites me to know that the medical community is starting to get on board with paying attention to climate change and coming out and speaking about how important it will be to take action on it. As you pointed out, not for people living far away, but for people living right here.
Mm-hmm.
And I hope that the medical community will continue to do that. It would be neat if they could come up with a card of some sort that many physicians could use when they have conversations with their patients, and hand it to them and encourage them as citizens to support actions on climate change. And Jerry, for us, it seems to me that the next time we go to lobby Congress, we ought to see if we can't get assistance from whoever is in contact with the medical community to have some physicians or other healthcare providers join us when we go to meet our members of Congress or their staff and to talk about this particular issue, because I think we elders have some power, but I think the medical community has some power as well.
So thank you for those comments. Yes, I'm heartened that finally the American medical community is getting behind this. As I said, the Medical Society Consortium involves 18 societies representing over half the physicians, and the nurses are also starting to get more involved with this. That doesn't mean that every doctor in those societies feels the same way. And I think that there's been a reluctance for physicians to get involved because the whole issue has been so politicized. And I've actually spoken out to physicians and wrote a letter to our internist magazine saying that there's a difference between being political and being partisan. And that being political just means saying these are policies that need to be there, and that for physicians to say this is a problem, it's serious, but I'm not going to advocate for any policy, just doesn't make sense. You know, we have a duty to protect. It would be like a patient coming into me and my saying, well, gosh, you have really severe diabetes. But I don't really want to tell you what to do about it yet, because, there's a disagreement between the pharmacy companies about which one. No. We have to, I think physicians need to get more involved in advocacy, and they're tiptoeing into it. I think we're getting there. You might want to look at the Medical Society Consortium. They have a wonderful website. I know Mona Safarti, who is working as the main organizer there from George Mason, has done some lobbying effort, and they might be able to help you with contacts for physicians who'd be willing to go in and see legislators. And whether that might be more powerful even at the local level, at your local chapters.
Thank you. Are there other questions? Pam.
May I ask a question to this last person, or to anyone though? You were talking about handing out a card. I think one of the other things that holds physicians back somewhat is that we're now asked to do so many things. In a 15-minute visit, make sure you deal with the problem the patient came in for, make sure their vaccinations are up to date, make sure their electronic health record is up to date, see if there's any domestic abuse, talk to them about smoking, and it's like physicians are reluctant to take on another thing. I wondered, so to talk individually to each patient, I think would be very difficult and might stir up uncomfortable things. But I wondered what you think. Would it help to have something posted in the waiting room? If there was something saying climate change could impact your health, just a general thing, would that influence patients sitting in a waiting room and reading that?
I would think it. I think it would, and it could be a plastified thing just to raise awareness.
Yeah.
A lot of people sit in waiting rooms, don't have much to do, and they pick up the little card and they read it, and it gives them a chance to ask questions, and it's done in a nonpartisan way and a low pressure way. I can't hurt, and it wouldn't cost much money.
Yeah. Thank you. All right, go ahead, please. The next question.
Yes, your last slide, I believe it was a quote from the Lancet Commission, and I can't remember what exactly it said. It said something about carbon reduction, but did it say anything beyond carbon? What did it say?
Yeah, the Lancet Commission said that the best way to inoculate human health against climate change is for governments to introduce strong and sustained carbon pricing. In other words, it's not enough for doctors to just say, oh, do something. That the most powerful thing is going to be carbon pricing. And all of the individual efforts that we're taking, and even our good, well-meaning friends are taking, oh, I changed my light bulbs. Oh, I'm only eating meat once a month. Oh, I'm getting so, all of those are good, but they're insufficient to the scale of the problem. You guys know that. And to get the transition quickly enough, we need carbon pricing.
But they don't say how much, correct? They just
No, they haven't gone into specifics of the policy. That would be more like our CCL policy would be one way of doing that. I happen to think it's the best way, but I might be a little biased. Did you have more questions about carbon pricing per se?
Well, I think it's a good way, but I'm not sure the $15, I think it's $15 a ton is enough to make a big enough difference.
No, $15, you're absolutely right. So it's strong and sustained, meaning you start with something and then it has to go up every year. So if it goes up $10 every year, in 10 years it would be $100, in 20 years it would be $200. I would contrast that with, for example, the Climate Leadership Council proposal, which is from the senior Republicans or eminent Republicans, that starts at $40 a ton, but it only goes up by 2 or 3% a year. That's not enough to make a difference. What that does is drive out coal and ensure that natural gas is there, but it's not going to really decrease overall use. So you have to be really careful about, I think you're right, you have to be careful about the actual policy. And I've often thought that, CCL celebrated its 10th anniversary this year. Well, so if $15 a ton 10 years ago, we really should be talking more like starting at $20 or $25 a ton now. But even more important than the starting price is going up a significant amount every year and setting that direction so everybody knows that's where we're going.
Thank you. Thank you. And I think
Oh,
everybody.
are you out of time, Jerry?
No,
Oh,
no, we're not out of time.
hi, Cynthia. I'm sorry.
Jerry.
So sorry I was late. I was wondering if you know how common is fracking in California. I remember a couple of years ago finding out for the first time that we were fracking here, and I was astonished.
Yes.
But I know we do.
Most people are surprised to realize that California is the third largest fossil fuel producer or oil producer in the country. We have a lot of oil wells and urban oil wells in Los Angeles. And we also have a lot of fracking. So Governor Brown has kind of walked this tightrope between talking about climate change, but then promoting fracking because they get a lot of tax revenue from it. And the fracking in California is particularly bad because they're allowing the use of the wastewater, which is contaminated with all sorts of things, to irrigate crops. So it's very bizarre. And you contrast that with a state like New York State, which has banned fracking.
Amazing.
So we could be doing a lot better on that. And, you know, honestly, 5 years ago, I thought, well, maybe natural gas is a bridge fuel. It has less CO2, but the number is amazing. If you have more than 3% fugitive methane leaks along the way, it outweighs the benefits of the lower CO2 content of natural gas versus coal. You've lost all those benefits. So these fugitive methane leaks that no one is measuring can be quite significant. And then I don't think most people knew that natural gas was achieved by fracking. I mean, we just didn't know that. And now that we know what it takes to get it and all the chemicals and all the water, I don't think it's a bridge anymore.
Thank you.
Thank you. Well, thank you, Dr. Mahoney. I mean, we have had a great deal of information and a fabulous presentation, and we really thank you. And I challenge you all to take this information and use it. Share the information with your friends, with your local community, with other elders. If you belong to a chapter, you can use the information with your chapter. It's a jumping point for you to go out there. Health is, quality health is, it's a shared value. It crosses the political divide. There's nothing, that you can say that it's, that you can refute it with. Health is, you either have health or you don't have health. And when you have disease or you have children with asthma who are in the emergency room, or grandchildren with asthma in the emergency room 3 or 4 times a week, you feel those impacts, and it's irrefutable. So it's information that you can use, that we can share with others and make people aware. I think if there's, we'll have this available on our website. The handout will be available on our website, as will the PowerPoint, and you'll all get the recording. So, feel free to spread this word. It's powerful, and there's a lot of support when you talk to people and you start talking about climate change, which is such a big, it's sort of an onerous issue where people cannot relate to it because it's so big. But then you start talking about, do you have, or anybody in your family have asthma? And everybody says yes. That you cannot find a family that doesn't have asthma in a severe way. So, that's a good way to start getting people to say, oh, perhaps it is climate change. And, perhaps we can make a difference. Mm-hmm. So that's our mission. And we will keep moving on this. Are there any other questions? We have time for maybe one quick question. Is it a quick one, David?
Yeah, it's not a question, it's a comment. Cynthia, I thought one of the most informative graphs you showed was the one that talked about extreme events over a period of time and compared the, I'm a scientist, so I understand this, compared the geophysical, which isn't changing, with all the other kinds, flooding and so on. I think that graph, if you show it to someone who's skeptical about climate change, well, we've always had hurricanes, we've always had tornadoes, we've always had wildfires. What's the difference? I think that graph showing the constancy of the geophysical events that don't depend on climate change with the other kinds of events is a very, very powerful truth. Thank you for that graph.
Thank you. Well, thank you all, everybody. Our next member call, our national call, will be on November 28th, which is the week after Thanksgiving. So I hope to see you all then. We're going to have a discussion about what we can do and some sharing some ideas. So I hope you'll all attend. We'll send out notices. Look for the newsletter. There'll be, our newsletter is focusing on health this month and health and climate change. So look for it there. Look for some good links and you'll get the information. And thank you all for attending, and good night and have a great week.